Hi everybody, welcome back. It's Friday afternoon, a little dark outside. We're expecting quite a snowstorm here in Chicago, at least half a foot of snow, but we're prepared. And I get to be making fresh tracks with my 8-year-old tomorrow morning on the hill going sledding. So I can't wait. I know some people have to deal with the traffic, but not too bad, as you can see from behind me. It's been a really exciting week. This week I drove up to Michigan, saw a client, met with a guy from the Insulators Union. Some of you may know that a lot of the insulators who worked with asbestos insulation, that's a union particularly hard hit by mesothelioma, asbestosis, and lung cancer. We work with Local 17 insulators here in Chicago, as well as the pipe fitters, the sheet metal workers, a lot of trades, but in particular the insulators. So it was nice to meet somebody up there. And then just now, I just came back from a deposition of Dr. Vignes Warren. And that leads us into what I wanted to talk about a little bit today, the treatment options for when you get mesothelioma. Dr. Vignes Warren is at Loyola. He's one of the most internationally renowned surgeons, especially for mesothelioma. Dr. Sugarbaker also did this surgery called a pleurectomy and a decortication. And Dr. Sugarbaker recently passed away from a heart attack about 6 months ago. But Dr. Vignes Warren at Loyola continues to do the surgery, and he was the doctor, the treating surgeon for our client who's up for trial this July. Our client is alive. She had the surgery. It was considered a great success, and he was asked about the process of it and how long it takes. But let me back up. I'm getting ahead of myself. So let's talk about the treatment options for when you're diagnosed with mesothelioma. The first thing, and I'm not a doctor, so I don't want you to take my advice as medical. It's more of a general explanation based on my many years of being around patients and doctors that deal with the same disease. So when you are first diagnosed, they look at your different treatment options and they say, okay, is this person eligible for chemotherapy? And do they want chemotherapy? And if so, do you want to be aggressive with the standard chemotherapy, or do you want to look around for a clinical trial? And a clinical trial is something that is experimental. I don't want to say a guinea pig, but they're testing out a drug on you, and because you have this serious disease, they want to see if this drug works. So what's cool about that is you get to become part of the progress of medicine. You can help push the treatment forward by allowing them to use the results of how the drug interacted with you and your cancer, and helping the patient in the next generation of patients and see if that drug is a success. So your chemotherapy options are none, standard regimen, clinical trial, and then if your tumor is resectable, meaning it hasn't advanced too far, you're young enough, you're healthy enough, you don't have too many other issues, you may be a candidate for surgery. And surgery, it's appealing generally because you can get that tumor out of there. Dr. Vignes Warren today testified in his deposition that he was able to remove 95 to maybe 98% of the tumor, basically everything they could see. And he was happy with it, although he was a little concerned because he had removed over half a kilogram, and he said once the tumor weighs that much, that can spell trouble down the road. But that's neither here nor there. The point is that surgery is sometimes an option, and your doctor will say, okay, go see a surgeon. You can go consult if your original treating physician thinks that that's a possibility. So those are the two main ones. Then there's also radiation therapy that can many times be in conjunction with chemotherapy. And then if you do have that pleurectomy, what they do is the lungs are like sausages, and the lining of the lung, that's the pleura, and that's where the tumor grows like an orange peel. And the pleurectomy is taking the pleura off, taking that lining off. You can only do it once, because once you take the lining off, the tumor, if and when it comes back, will go right into the lung. There isn't that pleura that it can grow on any longer. It'll invade the lung tissue. But it definitely can slow it down. So that's just to give you a very broad view of the landscape of the treatment options. So if you do watch this and don't take it too seriously, please go see your doctor and ask him. But my description is just meant to give you a broad overview of what's out there. So the good news was Dr. Vigneswaran had all good things to say about our current client, and that it went about as well as could be expected given the circumstances. And she is 73 years old. So this also to give you an age, if you're 73, you're certainly a potential candidate. And I also have had clients that are older than that. And every year I think and I hope that they get better at these surgeries, and they get better at identifying the tumor earlier. And just like chemotherapy progresses forward, so does the surgery. So it's exciting to be on the cusp of it, and it's something that, as a lawyer seeing a lot of patients go through this, we really hope that we can progress the research. And that loops back to why we do the 5K fundraiser in September, and why we try to get the word out so much through nonprofits like the Mesothelioma Applied Research Foundation, so that we can get more money to pushing back this cancer. So that's it. I hope you enjoyed it. We've got a couple other things I wanted to mention. We're doing that scholarship for academic scholarship for the law firm. So please send in your applications. I'll review them along with several other people in the firm, and we'll hopefully pick a winner. I think it's later on this year. And then for those of you who are cancer wellness fans, keep an eye out. The new issue is coming out February 1st, February 4th, right in there. So they're working on it. It just went to print. They're very excited. So keep an eye out for Cancer Wellness. It's a great magazine. This will be their second publication. So enjoy your Friday. Hope you have an excellent weekend. I know I can't wait to get it started. It's been a long week, but it's been a fun week. Thanks for tuning in.